Hi.
Hello.
Good afternoon. How are you?
I'm good. How you doing?
Good. I'm good. I'm Dr. Grace Stewart,
Nice to meet you.
Executive Family Medical Center. Nice to meet you too. Your name?
My name's Chris.
Mr. Chris. Okay. Well, welcome. So today I am actually going to stick you, just draw some labs from you. Okay. I see you've already prepared your arm there, so that's super.
Yeah.
And I'm going to talk you through this as I go. All right?
Yes, sir.
Super. Good. So I'm just gonna put on my gloves, and then we're gonna just extend this left arm for me. So it's really a really simple process, okay? Lots of people go through it many times a day. You have patients going through it. So no need to be nervous or overly so, okay? Okay. All right, so I'm just putting on my gloves to prepare. So the blood that we're gonna draw is for what we call an STD or STI. So, you know, back in the day it used to be STD, sexually transmitted diseases.
Right.
Some persons now refer to it as STI, so sexually transmitted infections. And most of them now are actually done through blood work and the urine test, as opposed to some other stuff. So we're going to get started with that, okay?
Good.
All right, good. So just stretch the arm right out for me, huh? Nice and straight, super. And I'm just going to tie this just around your arm. I'm going to have to do it tight, a little tight anyway, so we can get that vessel up, okay?
Yes, sir.
Super. So again, these labs do not require any fasting, for example. I'm just going to do it tight. Very good. Keep it nice and stretched. And this is just a little squeezy ball that you're going to just put all the stress and anxiety into that ball for me.
Right.
Open and close. You're doing really good. And this now is just the needle that we're going to use. Not all of this. It's really just the tip of it. I'm going to take this off. That's really just the tip that we're going to insert, okay?
Okay.
All right. But again, I will walk you through it, okay? We usually do not recap needles, but I just took that off so you can see what it looks like.
Got it.
Good. So now I'm actually going to clean the area with the alcohol soap. So it's going to be a little cool because it's been in the air conditioner. Just keep it nice and squeezed for me. Good. And keep the elbow nice and straight. Super. So I'm just cleaning with some alcohol. So it's going to feel cool. If it's been in air conditioning for a little while, the cooler it is, but it doesn't hurt, no stinging or anything like that. So I'm just locating which vessel we're going to use.
And while you're locating the vessel, Doc, how often should people come in and get tested?
Right, so we usually talk about annual labs. The person will have certain labs done at least once a year to get their overall status and what's happening with them, okay? So again, though, if something has happened between, say, doing it in January, for example, and doing it again the next January, then if something comes up, then they may need to repeat it for various reasons. So just take a deep breath in for me, my dear. You're doing so well. Excellent. Super. So just the tip of that again, not the whole thing. Okay? And then what we do is we just use these containers, and the blood fills into containers as much as we need. Now, we are now done with the blood process. I'm just going to loose this. Don't move yet. Excellent. Super. And I'm just going to use now a cotton swab. I'm going to put it right over the area. Now, sometimes when we pull it out, it stings just a little bit. Very good. Great. Super, super. So you can just bend the arm at the elbows for me. Super. And I'm just going to take my ball from you. Is that okay?
Yeah.
Very good. So just keep that like that, and I'm going to check it in a second. I just want to discard of this. Very good.
So how long does this entire process take?
Oh. If the veins are visible, if we can really get to them, and as you can see, that wasn't even 5 minutes, right? So it really depends. There's some persons whose veins are really bad, and so it may take a little maneuvering, or we may have to use little smaller ones that we may use in babies, and we may have to use a different spot, like on the bottom of the hand and that kind of thing. So it really varies, but on average, it's really just less than 5 minutes. There are some STIs that you will be able to pick up through blood work. And there are others of them that you will actually have to pass a urine sample, like chlamydia and gonorrhea. Back in the day, we used to do like a swab where we actually inserted it into the penile tip, and we kind of move it like a Q-tip, and we move it around to get the sample. But they've come up with a little better way now where we can actually use a urine sample that's passed in here. It's labeled, goes to the lab to determine some of those like chlamydia and gonorrhea.
Wow.
So that will be a urine sample. So again, painless, right? So just give me a second. I'm going to put a Band-Aid on that. Super. Just stretch it out for me. Very good. Now I'm just going to check. All right. Great. I'm just gonna put a little spot Band-Aid on there. See, again, nothing really to talk about.
And in your years of work, which common STIs have you noticed mostly, especially in people in their, young, in their early 20s?
Okay, so back in the day when the HIV/AIDS epidemic was more rampant, I suppose, then we would have found that a lot. And at that time, too, we found that persons who would have HIV or which eventually becomes AIDS would also have other STIs like chlamydia and gonorrhea or like syphilis, that type of stuff. Now that our incidences or numbers of HIV new cases and AIDS cases have kind of gone down over time, in terms of the number of new ones that we find at any one point in time, we don't see so many STIs now. And so now it's gone back to more things like chlamydia and gonorrhea, for example, VDRL, which is the syphilis. So we still see some of that, but again, as education improves and as young people become more knowledgeable about their own bodies and about health care, you find that they protect themselves more, right? Because things like chlamydia, gonorrhea, syphilis, those you can actually prevent by wrapping it up. I always tell my young people and my old people, doesn't matter if he looks like, he's, I don't know, who, Arnold Schwarzenegger, buff, blue eyes, blonde hair. Listen, I have seen people that look me in my eye as a physician. They are the patient and I have their notes. They have looked me in the eye and I would say to them, do you have any medical illnesses like blah, 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 HIV? And they look me in my eyes without blinking and they say, no, doc. Okay? So I'm saying, so I tell my young people, gone are the days when you think they're going to blink their eyes and then they lie. No, their eyes don't blink and they lie. And they lie to people like us who later on can go back to the notes and say, if you're going to lie to me, who has access to the notes? You think they're going to lie to you? Yes. So if you're not sure, if you have a little bit of doubt, the best thing to do is come to that understanding that, let's wrap this up until we understand each other a little better.
And then on the topic of lying, because Chris and I were talking a little bit about this, can you speak a little bit about the confidentiality that comes with this? Because a lot of people tend to get afraid because they feel like, well, if I go, someone may know me, and then the entire country will know what I tested positive with if I do. So.
Right, so in terms of medicine, confidentiality is a big, big deal. It's certainly a big deal here for us at Executive Family Medical Center, and with me is Dr. Grace Stewart. Because the bottom line is, as long as you're over 18, I don't even have to tell your parents. Okay, I have family members sometimes who may come to me and I say to them, in here, you are my patient. Out there, you're my whatever you are to me. And unless you tell somebody that you came to see me, or unless you tell me to tell them, that's confidentiality. And so, we try our best to teach it to our students, to our medical students, to our residents, because if people have no confidence in your ability to keep their information private, then it's unlikely that they're going to come back to you. It's unlikely that they're going to send others to you. And sometimes information like that, if it gets out, can cause persons to do harm to themselves as well as to others. So to minimize stuff like that, confidentiality is key. So yes, the information goes out, it goes to the lab, the results come back, and that information is not divulged to anybody except the client. Having said that, if the patient is minor under the age of 18, then of course the parental guardian who would have brought them in, because we won't see them without a parental guidance, those persons will we will speak to the parents as well as the child.
And in telling people to practice safe sex, is it safe to say that condoms are effective against protecting you in all STIs?
Generally, condoms are one of the safest means of protection against STIs. Having said that, as physicians, we are always very careful to remind persons that nothing is 100%, right? So even when we use condoms with regard to pregnancy, for example, sometimes it can rupture, sometimes the condoms can break, as young people say, or rupture, and so you still have that potential, but the risk of those potentials are very, very low, whether it's with an STI or even with pregnancy, but nothing is 100%. But yes, the percentage of being able to protect you from what you're trying to be protected from is very high, at least about 98, 99%, yes.
Okay. And now that Chris has actually gone through and he has taken this test, when can he expect to get the results?
So for the most part, the results should be ready within a few days. depending, of course, on how much work the lab has, how backed up it is, but that kind of thing. But on average, it's usually within a few days, especially for the basic ones. Now, if there's something, far and, it's not commonly ordered, for example, then sometimes the labs may take a little longer with that because they may have to send those off. But the routine STIs, for the most part, are done in country, and so the turnaround time is usually within a few days.
Okay, that was some great information.
Super, good to have you. Nice
Yes.
meeting you, Mr. Chris.
Yes, sir.
So I'm just going to wash my hands. Remember the mask wear, social distancing, hand washing, because we need everybody to do their part with this COVID situation, okay? You're very welcome. So nice seeing you.
Yes, sir. Thank you.
All right, you're welcome.
Thank you.
Bye-bye.
How you feeling?
I feel
Truthfully.
fine. I just feel like, it's just always nerve-wracking every time.
Yeah.
Every time. I
Yeah.
know. If you change partners frequently, get tested, If you ain't so sure and you slap up a little bit, get tested.